Hi, Dr. Francis Yu here, and we're talking about the Enneagram for physicians, and we're talking about the type 1. And the type 1, a way to look at it is the spine, right? The spine, we talk about sitting up straight, right? But the spine, as we know, has these normal curvatures, these kyphoses, and the lordoses that are normal. And when we're sitting up straight, we're actually not making the spine straight. We emphasizing the normal curvatures that are there. So a good type 1 in all of us, but especially for people who are the type 1, it is about accentuating and getting that right tension that is there in the spine when we are sitting up straight with the normal curvatures that are there. Now, the trouble starts when we think it needs to be more straight. It needs to be more rigid. It needs to be more structured. And in a way, you can compare it to, let's say, a person with a bamboo spine or a spine that has significant osteoarthritis, and now you have these uh, extra joints that have been created by these osteoarthritic changes. And that is the comparison I would make to the more healthy side of the type 1, which is to be more, let's say, more open to tensile forces, flexibility, and knowing that there is this normal curvature to get back to. So in this analogy, the spine is this straightness and this flexibility, it has adaptability. And the pathology or the struggle or the challenge or the lesson, the type 1 lesson, is to not be so rigid and so stuck and so focused on what to make better that actually the spine loses its flexibility. Another way to look at it is we all know what quality improvement is. I would say QI projects are, in a way, can be like a dream job for a type 1 physician, for certain type 1 physicians. Because all what it's about, Lean Six Sigma is, define the problem, measure the problem, analyze the problem, improve the problem, and then you control the process. And the type 1 is great at finding flaws, right? And then coming up ways to improve them and get rid of the flaws or improve the process, make things more efficient, more efficacious, better use of resources so that everything is working better. Now, this is good when we have measurable data, right? Let's say we have certain lab results we want to improve. There is a patient's weight we want to improve, or the productivity of our business. These measurable things which can be measured and improved. And in that sense, that is very useful, and this improvement mentality makes a lot of sense. But where does measurement in trying to improve things, that is not the home, that is not the realm of the Enneagram. What we're talking about here are not quantitative changes and improvements of our wellness, of our life, of our dreams and our visions and what we want to get done, our relationships, our job. Yes, there are quantitative elements, and we can try to come up with some subjective numbers, but in no way is the is the flexibility and the goodness and the principles that we are talking about here. They are not quantitative in terms of, okay, I can score my life 65 out of 100. Yeah, I passed. Or 65 out of 100 isn't good enough, so I have to get to a 70 out of 100. Actually, I would say this is, in a way, what a type 1 person gets into trouble, where they're trying to make qualitative improvements, right? To their life, to their relationship, to their profession, to their wellness, whatever it may be. And shifting into this almost quantitative model, good enough and not good enough, or not quite good enough, can be better, can be better, can be better, can be better. The trap. Things can be always be better. Technology is going to improve. You can sacrifice more of something else, let's say more of your sleep, to work more on your practice or your business or whatever it may be. But the wellness journey, the personal development journey, the wholeness journey, to find essential quality and what's good and great and healthy and awesome about us, in particular for the Enneagram Type 1, is this. It's to go deeper, not a farther distance. It's to go deeper to discover, recover, uncover, and unwrap this acknowledgement and assessment of I'm good. I'm good. So that's a phrase that I would say people on the younger side of my age is they say I'm good. And what they mean by that is not that they're good, as in things are absolutely perfect. It means they're satisfied and their level of contentment is adequate for that moment. And it reflects an evaluation of where one is right now. So the question for you is, where are you right now in your journey, in your inward journey, to discover yourself, to further your development, for your wellness, and just to be at more home with yourself, to return to yourself, to know yourself, and to go deeper to accept and acknowledge that place that is so wonderful that's already there. And for the Enneagram Type 1, what that is specifically is being able to say, I'm good. I'm good right now. And to expand that, things are good. You're good. I'm good. We're good. And that's not to say we can't quantitatively measure things and make things better. Yeah, that's perfectly permissible, allowable, and should happen. That's how we make advancements, right? But there is a sense of, it's okay, I'm good. Or, yeah, you're good. Don't worry about it. And it's this, I wouldn't say okayness, but it's the, I'm here and I'm good. I don't need to be better, but I can. You know, that person, this situation can be better. They don't need to be better, and I don't need them to be better, but I want them to be better, and I would want them to be better. And that is a great way to also talk about the Enneagram in general. It's about not needing things to change, but wanting them. I think as physicians, we are taught a lot to not enjoy what we have, to enjoy what's going on and just what's there. you need to strive for more. You need to improve this. This needs to be better. This needs to be better. This needs to be better. I need to be better, right? And the table flipping, the perspective flip I want to give to you from the Enneagram 1 space of the spine, as it were, is you don't need to be better. Things don't need to be better, but want them to be better, but being okay and satisfied with the way things are. I'm good. And no longer struggling endlessly against, I need to make this better. I need to improve this. I need to improve X, this person, and myself. No, it's, you're good. I'm good. But I would want things to be better. And if it doesn't move that way, it's okay because it's good. And I'll end with this. So when I'm examining patients, and I work a lot of people with neck pain, back pain, and I find a lot of them are tense, right? Tense neck muscles, shoulder, trapezius muscles, etc. And I tell them, relax. So let me assess your range of motion and your neck and feel what tension's there. But I think in a way, this telling or trying to relax is an oxymoron. Because once you're trying, you're no longer relaxed. In a manner of speaking, relaxing is something that happens when you're not trying, meaning the effort or the striving is not this impulse to improve or better things. So for the type 1, the relaxing into the type 1 is remembering the good, the relaxation into the good of how things are. And whether you want to say it's sinking into it with gravity or floating into it with levity or whatever it may be, the wellness lesson for all of us, but in particular, this is what the Enneagram Type 1 struggles with a little bit more, is relaxing into, I don't have to do things to make things better. I can want to, but being so invested in the bettering and bettering and bettering is what burns out the Type 1 physician. That's that candle, the wick, or the whatever you want to call it, that's that element that's being burned and lit and keeps the type 1 person going. But that is also the most actively lit, meaning for the type 1, the striving to improve and bettering is the part of themselves that will burn them out. So, in other words, pay attention to, are you focusing so much on bettering things and bettering things and bettering people and bettering yourself, criticizing everything and everyone, and mentioning, oh, I could be better, or oh, no one else is going to do this, I'm the responsible one, or who's taking care of this, and being very, almost overly principled and becoming so rigid like a bamboo spine, you lost the goodness and flexibility of the integrity of the spine, right? By trying to force integrity on the spine can cause the loss of the true integrity of the spine. So that's the analogy for the type 1. If you're not sure if you're a type 1, if you don't know what your Enneagram type is, you can come talk to me. I provide professional Enneagram typing and coaching services. You can go to www.theenneagramforphysicians.com, or you message me on social media at Dr. Francis Yu. And I would love to talk to you about how the Enneagram can be helpful for your personal development, your physician wellness, your physician well-being, and really how to live a fulfilling life as a physician. And Enneagram is a wonderful tool for that. All right, thank you for watching. This was Dr. Francis Yu talking about the Enneagram for physicians, and I'll see you next time.